Okay. Morning, everybody. I'm Jaco, Vorster, a registrar of otolaryngology, and I'm going to present a journal club article this morning. The article I chose to present is lipid-laden macrophages, index as a diagnostic tool for pediatric aspiration, a systematic review. The main author, Claire. Of note, this is a systematic review of out a meta-analysis published in the Open Journal. So the reason for choosing this article is in the pediatric clinic for one of the airway patients, we had a patient in which they did lipid-laden macrophages on the bronchoalveolar lavage to screen for aspiration prior to a surgical procedure. But the histological report only reported the percentage of lipid-laden macrophages, but they didn't comment on any range or on how to interpret the result. So it was quite difficult to interpret this result. And after a quick Google search, I realized that there's no clear cut-off values for the lipid-laden macrophage index to guide as to whether it's positive or negative. And then I also thought that it would be quite a useful tool as a biomarker for aspiration, especially gastric aspiration. And the importance of this is aspiration can be quite challenging to diagnose, especially if it's silent aspiration. The diagnosis of aspiration is not standardized, and the current diagnostic tools all have limitations attached to them. And early diagnosis of aspiration can prevent devastating sequelae in patients, and it will help us to stratify high-risk patients, especially patients with structural airway abnormalities. I'm thinking specifically of patients with laryngeal clefts and patients with laryngomalacia, where it could be quite useful to know whether or not they're aspirating gastric content. Might need further intervention for that. Also of note is that in preterm infants and neonates, they have a poor cough reflex. So there's poor clinical indicators in these children of aspiration, and they are more likely to silently aspirate and not to pick up. So just a quick look at what is lipid-laden macrophages. So the literature is reported as a routinely used marker of aspiration, especially in the pediatric population. It's obtained via bronchoalveolar lavage of right main bronchus and then sent to histopathology for staining. It's proposed that the lipids in the gastric content that gets refluxed and then subsequently aspirated into the airway gets digested by the alveolar macrophages, and this can then be picked up. So not the first study, but one of the first studies by Colombo and Holberg that looked at it, where they described that oil red O stain is used to stain the aspirate, and then they look at 100 consecutive macrophages individually for the quantity of lipid accumulation. And then for each macrophage, they give a score out of 4, with 0 being no lipid seen, and then 1 if there's up to 25% of lipids seen, or the cytoplasm is classified by lipids, and then 2 up to 50%, 3 up to 75%, and then 4 up to 100%. And then they give a total score out of 400, which can either be reported as an absolute value or as a percentage. This is just a picture of what the lipid-laden macrophage would look like on a microscopic view, with all these orange dots representing the lipid in the cytoplasm. So just also looking at a few definitions that is used within the article. So aspiration were defined as a passage of saliva, food, or gastric content into the airway. Silent aspiration, they reported as the absence of a cough or other response to solids or liquids passing through the vocal cords. And then microaspiration has not been defined in the study, but it is talked about a lot in other literature. So I thought it would just be useful to find that as well. And that's termed the asymptomatic aspiration of small volumes of oropharyngeal or gastric content into the lungs. So the study question in this particular study was whether there's clinical correlation between lipid-laden macrophages and pediatric aspiration. So inclusion criteria used in the study, they used a PICO tool to evaluate inclusion criteria. So first, the population was defined as patients under 18 years of age. The intervention group was patients who are clinically or radiographically diagnosed with aspiration, and then a comparison group of patients who are clinically or radiographically non-aspirators. And then the outcome measured here was the lipid-laden macrophage index score. So just moving on to methods. So data collection was done by a wide data search, and they searched three databases, namely PubMed, Scopus, and Cochrane. And they did search some other smaller databases, but that didn't add any articles. So they identified 146 articles. Only ended up screening 25 other articles, and then they only included 5 articles in this review. So the evidence base of the 5 articles, 3 were retrospective case control articles of level 3B evidence. I mean, 2 were prospective observational studies with also of level 3B evidence. So overall, the evidence base is not that great. The way they handled bias in the study is they used the Miner's instrument to assess it, but they did not fully elaborate on findings and how they dealt with bias in the study, so it's very difficult to comment on that for this particular study. Looking at the results, the whole systematic review looked at 720 patients over 5 studies, of which 263 of the patients were aspirators. So that's about 57% of the patients. They deferred statistical analysis in this article, and the reason for that was there was lack of uniformity in the report primary outcomes, and then there's an inadequate control group with lots of heterogeneity in the control group regards to comorbidities and indications for bronchoalveolar lavage. So just a snapshot of the results. These are the 5 studies they included. And then the second column, they report the mean lipid-laden macrophage index. So it's a score out of 400, with the first value being that for aspirators, and the second value that being for non-aspirators. So just looking at the bottom study, that's the first one, that the oldest one that they looked at, and there was 159 was a mean score in aspirators versus 46 in non-aspirators. Unfortunately, they didn't report a p-value, but they did report the results as statistically significant, and strongly encourage the use of lipid-laden macrophage index as used for assessment tool. And then the study in 1999, they also reported great outcomes with 104 for aspirators versus 44 for non-aspirators. And then again, the study in 2007 reported 253 versus 188 which reached statistical significance with a p-value of less than 0.05. And then the two later studies did not reach statistical significance in the literature, and they discouraged the use of lipid-laden macrophages. Just looking at further the lipid-laden macrophage index that they used as a cutoff to define aspirators versus non-aspirators in these studies. So the later two studies did not define a definitive cutoff value. And the 2007 study defined a cutoff value of 165, which was quite high compared to the prior studies of 85 and 90. So just looking at the strengths and the weaknesses of this study. So the strengths, it was a systematic review, and they had a comprehensive search strategy with good reporting on the quality of the studies, and they had very transparent reporting with regards to the limitations. Heterogeneity, as weaknesses, there was quite a bit of heterogeneity in the study designs, and then there was lack of standardization in diagnostic criteria for aspiration. In the studies, there was diverse control groups, and then the lack of consensus in the lipid-laden macrophage index cutoff. So just a few points from the discussion part of the article. So there's lipid-laden macrophage index is not a very specific tool, because quite a few other things can also raise the lipid-laden macrophage index, and that's stuff like lipoid pneumonia, fat embolism, cystic fibrosis. Immunosuppressed patients also have a higher lipid-laden macrophage index, parental nutrition, and etc. So just again, some of the controls had underlying pulmonary disease. In one of the studies, they used only a documentation in the patient notes of aspiration without supporting evidence. So these patients might not have had a fees or clinical assessment for aspiration. None of the studies used fees to define aspirators. Silent aspirators may have been missed in these studies. And then also with the lipid-laden macrophage index, there's significant inter and intra-observer variability in the reporting of lipid-laden macrophage index, since it's not a specific marker that's measured, but rather somebody having to grade the percentage of cytoplasm that's pacified by lipids. Just it's not part of a discussion of the article, but there's no randomized controlled trials available with the use of lipid-laden macrophage index, which also brings down the level of evidence. So in conclusion, they rated the sensitivity of lipid-laden macrophage index between 57 and 100%, and the specificity of 57 to 89%. So there's a potentially poor specificity and sensitivity. Previous studies did not really report on the statistical significance, unclear cutoff values. And then just looking at other modalities that's in use, so fees and video fluoroscopic swallows, or modified Borum swallows, they in literature report about 82 to 100% specificity and sensitivity. And then milk scans or technetium labeled scans for reflux and aspiration, they've got very poor sensitivity for determining aspiration from gastric reflux, about 15 to 59% sensitivity. So overall, there's no recommendation at the moment to strongly support the use of lipid-laden macrophage index. This study does not disprove it as a marker, but does identify quite a few gaps in the literature and the difficulty of